Hi, welcome back to our channel. I am Dr. Kimberley Wilson. I am a pelvic health physical therapist. I'm also a Mercier trained therapist. I am a pregnancy and postpartum corrective exercise specialist. I am also a certified Mercier Fertility therapist, right? So I deal with work with clients who are having issues with infertility. And so I wanted to do this video on addressing one of the most common questions that I get related to issues of infertility. And that's dealing with hormones. Specifically, which hormones should clients be concerned about? Which ones should they be tracking? Which hormones have the most impact on infertility? So before I do that, let me first sort of define what infertility is. So infertility is defined as anyone who has been unable to become pregnant after trying for 12 months or 1 year with unprotected intercourse. And then that sort of changes as a client ages. So by the time you reach the age 35, we start to shorten that to like 6 months. And then 40 and older, we shorten it even more to 3 months. And the reason for that is that the older that we get as females, right, our hormonal issues are way more complex than men. So as the older that we get, the fewer chances that we have to get pregnant each month decreases, right? And so we don't want women by the time they reach 35, 40, really wasting a lot of time. I really shouldn't say wasting a lot of time, but spending a lot of their energy or time trying to get pregnant on their own or dealing with those issues on their own. So we want them to start seeking help a little bit quicker, right? Just because of the nature of the time that we're dealing with. And then I also want to be sure to say that when it comes to infertility, the research shows that about 1/3 of the issues of infertility are male, about 1/3 of them are female issues, and then another 1/3 of them are both male and female together issues, right? So it's not just a female issue. So I want to be sure and say that right out of the gate. But since I've already mentioned that the female hormonal world, right, is a little bit more complex, I would say, than males. Males tend to be a little bit easier to overcome. Then I certainly wanted to address the female stuff today, right? The females who I see the most. Those are the ones that come to see me and who pose the most questions about that. So let me just kind of get started with that. So infertility, it can be anatomical, meaning the organs themselves. So if you think about the reproductive organs for the female, we're talking ovaries, uterus, fallopian tubes, things like that. So anatomically speaking, an infertility issue could be the organs themselves, like the position of the organs. If there's kinks in the tube, right? If there's some twisting or kinking going on in the fallopian tubes, the placement of the uterus itself. Sometimes the organs just kind of get a little bit stuck. There's not a lot of mobility going on in the abdominal cavity, right? So if there's not good mobility, not good movement within the organs themselves, then that's going to lead to another issue related to poor blood flow, right? Poor nutrients, right? They're just not very efficient. And then the other thing I want you to think about is not just anatomical, but physiological, right? So think ovulation, think structural changes that might happen if there's a surgical procedure like a LEEP or even just a gallbladder removal. So that sort of changes the physiological nature of the reproductive organs. And then lastly, thinking physiologically, that is the hormonal issues, right? So big picture, the hormones are very important. So let's kind of get right to it. Just want to kind of go through a list to begin with. So the ones that I consider of utmost importance when I'm dealing with or working with a mom who has some issues with infertility. I'm going to be looking at the AMH, FSH, LH, estrogen or estriol, testosterone, progesterone, DHEA. Also going to look at the thyroid hormones, cortisol levels, and then lastly, vitamin D. So let's kind of take those one by one just real briefly, because I want to keep this video kind of concise and short. Just kind of give you just a brief overview, not anything too deep or too complex here, right? So AMH is a hormone that can be checked, and it sort of helps us to determine the number of follicles that are left inside the ovaries, right? We know that girls are born with all their ovaries, right? And so by the time you reach reproductive age, there's a certain amount of follicles left in the ovaries, and that's what we call the reserve, right? And so the AMH can be tested at any time during the cycle, right? FSH, that is the follicle stimulating hormone, and it gives us an idea of what's kind of going on with your egg reserve, or what's going on inside the ovaries. Too much FSH might indicate that the eggs are just not maturing. They're sort of like getting stuck in this immature state, right? Not moving on to that mature level. So if the FSH, that's a hard one for me to get out, but if it's too high, then that's going to tell us that they're sort of stuck in that immature state. FSH tells the ovaries that the follicles need to start growing, or they need to start maturing. And so FSH, if this happens, if the eggs start to grow or mature, the follicles, right? We want the follicles then to mature to eggs, right? And so if this starts to happen, then what we're going to see is FSH levels start to drop, all right? And it's best to test this between days 2 and 4 of your cycle. So that kind of optimal day being day 3. And the reason that we do that on day 3 is because estrogen and FSH work on a feedback loop. And if we get it along that day 3 timeline, then estrogen's gonna be naturally low. And so that gives us a really baseline picture of where FSH is at without the influence of estrogen trying to pump it up a little bit, right? So we like to do that between day 2 and day 4. AMH can be tested anytime. The next hormone on the list is LH, that's that luteinizing hormone. LH also works on sort of a feedback loop with estrogen. And so during the cycle, LH stimulates estrogen production, and they work on this feedback loop. And then along mid part of your cycle, you get this LH surge, right? And what does that do? That stimulates ovulation. So LH is very important. Want to make sure that it's in the picture. And then later in the phase, so like after you ovulate, then LH will help that corpus luteum, right, that luteal phase, to keep producing what we need it to produce, the estrogen. We want to look at estrogen, and typically estrogen is tested more after ovulation, so along day 19 of your cycle. Estrogen is secreted by the follicles within the ovaries during the follicular phase. And then, like I already mentioned, after ovulation, then it is secreted by the corpus luteum in that luteal phase. Estrogen is important because it helps to create that cervical mucus that then allows the sperm safe passage into the cervix and helps obviously fertilize the egg, and so that's what we're seeking for. Estrogen also prepares that endometrium so that once the egg's fertilized, it has a safe place to implant, right? So very, very important. Testosterone, I mentioned, that is also a hormone that we want to know. We want to know what's going on there, because if it's too high, it's going to interfere with that whole endometrial development. It's very important as it relates to estrogen. And then if testosterone levels are too low, we are not going to have sufficient estrogen either. So we want to know where that guy's hanging out. And then one of our favorite hormones, it seems like, in the whole infertility world to talk about is progesterone. And it is a very important hormone. I sometimes refer to it as the calming hormone, right? So if estrogen is responsible for getting us pregnant, then you might look at progesterone as the hormone that keeps us pregnant, right? So it is produced by that corpus luteum after ovulation, and it helps to form that ever important blood network, right? Once the egg is implanted, it's fertilized, it's implanted, then we need blood vessels then to start to grow and that placenta to start to form, and progesterone is very, very important for that. Interesting, progesterone will also help to sort of lower that immune system response, because we know that sometimes when miscarriages are happening, it's because your body sees the implantation of the egg into the endometrium. It sort of sees it as an invader. And so we need that progesterone to kind of lower that immune response so that your body can accept this new life that's forming, right? Progesterone also helps to improve nitric oxide so that you get that nice, rich, all-important blood flow going into the uterus. It sort of calms or decreases that contractility of the uterus so that it remains calm throughout this process. And so definitely want to know what those progesterone levels are. Typically, they will test those again after ovulation, because that's when you start to see, after the corpus luteum is formed, that's when you start to see progesterone sort of start to peak. So it's a good time to test that is after ovulation around day 19. DHEA is another hormone that has gotten a really good research to support good levels of DHA. It helps to improve the quality of the ovarian reserve. And so we know we want good quality eggs that are being released by the ovaries, and then once they are fertilized, then go on to produce healthy babies. So DHA is very important. Also, we like to look at thyroid hormones. So absolutely TSH, TPO, T3, T4. We want to know all of those numbers. T3 has been found in the cervical mucus. So yes, it is very, very important. All those thyroid levels are very important. And the last one that I want to mention is vitamin D. Vitamin D, there's a lot of research that still needs to be done really on how that might impact fertility, but I do know that there have been some pretty eye-opening research studies on PCOS clients specifically. There were some clients in one particular study where the only intervention was vitamin D, and there was a large percentage of those clients, the numbers are not coming to my brain right at the second, but a large number of them became pregnant, and vitamin D was the only intervention. So we do know that that is a very important part of our body, that we need to be producing good vitamin D. We also know that typically most people are deficient in that, right? We don't get outside like our ancestors did, right? So we're not out in the sunshine getting the vitamin D or making the vitamin D like we should. Most of us are not grounded, right? We're not in contact with Mother Nature, with Earth, like our ancestors were. So there are some deficiencies there. And a lot of that ties back to the immune system, right? So we want to make sure that we're getting sufficient vitamin D. Obviously, balancing and supporting your fertility hormones is way more complicated than all the things that I mentioned here on this video, but it's very individualized, right? So it varies from client to client. There's client history to consider, and so many things that need to go in figuring out where to start with helping to support this this part of your body. But in my practice, these are the tests that I initially start with, and then from there, then we start to piece together a good kind of plan, right? We want to build the best plan of action that we can based on each client's history and kind of where they are at in the present moment. And hormone testing is the perfect way to start that, right? It's a start. It's not everything, but it's a great start. So I hope all of this information helps and kind of sparks your interest on where you might be in your fertility journey, or somebody that you know and love. And if you have any questions, please feel free to reach out, contact us. We can absolutely have a conversation about what's going on with you, and hopefully answer any questions that you might have that I didn't cover on this video. And if you have topics that you'd really be interested in me trying to cover for you, then please shoot me some ideas, and I'll be happy to discuss that on upcoming videos, right? All right, so I look forward to the next video and look forward to meeting so many of you and helping you along your fertility journey as well. All right, hope you're having a great day, and I'll see you soon.